Sam, go ahead and take it away.
Hi, everybody. My name is Sam. I am one of the interns with NHPC. I hope everyone enjoyed all the research they learned about today and about how to dive into research if you're not involved in research yet. I personally enjoyed the first section because I felt like I was able to resonate a lot with a lot of the stuff that he talked about. So now we're going to be having our medical student panel, and we have these three amazing, smart, and talented medical students. We have Cece Chen. She is an M2 at Mayo Clinic, Alix Earl of Medicine School on the Arizona-Florida track. She is originally from Cincinnati, Ohio, and completed her undergraduate degree at the University of Pennsylvania. She majored in biochemistry, neuroscience, and healthcare management. Sumedha is also a medical student at Mayo Clinic and is a current M2. She is originally from Oak Park, California, and graduated from the University of Southern California in 2021 with a degree in health and human sciences. Our last panelist is Camryn Payne. She is also a student at the Mayo Clinic, Alix Earl School of Medicine, and she's a first-year student. She is originally from Tucson, Arizona, and graduated with a degree in bio from Washington University in St. Louis. I'm going to pull up the Q&A. Please feel free to ask anything. There are no silly questions. I will start off with the first question. What have been the most significant ethical dilemmas you've encountered in your medical education, and how did you address them? Was I off mute?
Nope, you were good.
Okay.
I think we're all just thinking because
it's a tough question. That's a really good one.
But I think ethical dilemmas, luckily we haven't, or I'll say I haven't faced a whole lot here at Mayo. I think one kind of general thing we run into is if we're working at some of the student community clinics, or working with underserved populations, we'll often need the help of a translator. And translators aren't readily available. We often have a shortage of translators. So it then becomes the question of, are you allowed to ask a family member for help with translation? How do you go about communicating with a patient without, running into any conflict of interest? Because you don't want to put a family member in that position of having to translate while also processing all this information that you're giving them, right? So I think that's the biggest one that I run into, but luckily we've been able to kind of expand with like virtual translators and use iPads and things like that. So that's been a really great way to kind of avoid that situation.
Yeah, I think adding on, because Sumedha and I are both M2s and then Camryn's an M1. So I don't think any of us have done our clinical rotations yet. So most of it, what we've done is like just preclinical stuff. And so I think during like your rotations, when you're actually at the hospital every single day, I think that's kind of where you see more of like the, patient interactions, and sometimes things can go awry there. But I definitely agree with what Sumedha said too about kind of, the use of translators. And also we have like a few different student run clinics or just clinics for people who don't have insurance, and we kind of have part of our curriculum is to go help out there. And part of it, I don't know, for me, part of it was always been like, is there a reason why they always send students to community clinics where the people there don't have insurance versus like sending us to like, Mayo Clinic and having us necessarily like do work there and actually participate in the care and write notes and stuff. Because when we go to Mayo Clinic, like we don't necessarily write the notes for the patients. It's like the doctors are still kind of the ones who are doing all that stuff. And so in some ways, I feel like that could kind of be seen as like a disparity where their care. Obviously, it's great practice for us, but I think sometimes like the imagery of that might not necessarily be the best. And I know other schools kind of have that same dilemma sometimes. So I think that's something that has just been kind of floating in my mind.
Thank you both for your transparency. Camryn, did you have anything you want to say on that? If not, it's okay. There's so many more questions.
Well, I'm in M1, so I haven't had too much clinical experience yet, but I do agree both with what Cece and Sumedha said there.
Nice. The second question, did any of you take a gap year and what did you do to prepare for medical school in it and how long?
Yeah, I did take a gap year. I graduated college in May 2022, and I spent my gap year working as a medical assistant in an orthopedic surgery practice. This was really great experience. It was a lot of really hands-on patient interaction, which I really enjoyed. It really helped build my confidence, like interacting with patients, asking them questions about like medical history, recovery from surgery. All that was really, really cool. I also had a lot of experience working with doctors, PAs, bunch of different people in the healthcare field and seeing how like their different roles worked and how they all work together to, help patients, through the process of surgery and recovery. And I'm really grateful for that experience. I had a really good time.
I also took one gap year. I worked as a research assistant at Northwestern in Chicago. And that was a really cool experience because I have lived in California my whole life. So it was a great chance to kind of be in a new environment, but also I learned a lot about the ins and outs of research. And I was working in neurology, which was something that I was really passionate about. So yeah, that was a fun time. And then I tried to shadow when I could.
I also took a gap year between graduating and starting med school. So during that year, I was also kind of like a research assistant lab tech. And I just stayed at the same research lab I was in during undergrad. And so it was kind of like a pretty seamless transition. And it was nice because I kind of already knew everyone in the lab and gave me a chance to get a little bit more involved in research because I feel like during undergrad, you have classes and a million other things going on. So you're always kind of in and out of the lab. And it's hard to really see a lot of projects through from start to finish, especially if it's like a long experiment. And so I think like my gap year gave me a really good chance to really follow through on a lot of these experiments that I was doing. And I was working in a liver research lab. And so looking at a lot of like congenital liver diseases and kind of what the etiology behind some of those were. So yeah, and I've always been kind of interested in like wet lab research. And so it was
Thank you everyone for that. A common question, this has been asked a couple of times, has kind of been about the balance of the requirements for medical school, including research, clinical experience, volunteering, and the academic work that you have to do before that. I guess mostly for students who are in undergrad, who are still in undergrad, taking the balance between completing any of that after they graduate or having to stuff it in before they do graduate.
I think there's so many different paths you can take to medical school. Like we have classmates who, worked in a completely different industry for like 15 years and then came back to med school. We have people who came right after they graduated college. So there's really no like one size fits all way to do things on your path to medical school. I was only kind of at college for a year and a half because I was at home for the rest during COVID. So that was particularly challenging to find ways to still get out and go shadow or volunteer or even do research. So, there's a number of factors that will affect kind of what you can do and when you can do them. But I would say just try to find activities that you're really passionate about. and that you really enjoy doing. You know, there's 10 different ways to volunteer at a hospital, but if you can find the things that you're really interested in, that'll make for more fulfilling experience. And I would say it doesn't really matter too much between doing it while you're in college versus after. I think the bigger idea with admissions is they just want to see that you've had some exposure to medicine and that you know what you're getting into.
Right. I think another thing is like a lot of times as pre-meds, like I feel like we have such like a checklist of things that it feels like we need to do, you know, like you need to get 1,000 clinical shadowing hours and like XYZ hours of like volunteering. And I feel like for me, that was also like going through undergrad, kind of like always kind of like a storm cloud over my head, I guess, because it just feels like really overwhelming, all these things that you have to do. And as I was applying, I think like talking to a lot of my classmates, like you only have so many hours in the day, and it's gonna be impossible to like really be a star in everything. And so I think what Sumedha was saying, where like it's more so on like the quality of experiences that you have versus the quantity. And especially as you go through the application, you'll see that like on the application itself, you only have space for I think like 15 activities or something like that, which sounds like a lot, but like honestly, you know, some of those can be hobbies. And so you don't want to just dip your toes in a ton of things and not really be able to speak to any of them versus like getting really involved in two or three things and being able to like share about experiences and like things that have changed you from doing those. Because I think that at the end of the day will make for a lot more of a, I guess, genuine application that stands out. And also it'll take a lot of pressure off you too, because like for me, example, like I didn't shadow that much at college at all. And so in terms of like clinical hours, especially with COVID, like I don't think I had that many at all. And so you know, I listed on my application, but I was able to also talk about things like research maybe that I was able to do a little bit more of. And so um it really is just you pick what you're more passionate about and just be kind of honest with what you've done. And I think that will speak for itself.
Yeah, I would agree. I think definitely when it comes to like activities and checking boxes, it's more of like a quantity or a quality over quantity type of things, and really investing yourself in different projects, opportunities that are both, you know, meaningful and fulfilling to you. Because, you know, the things that you're going to do the best at are the things that you truly care about and are truly passionate about, and that you're able to, you know, that'll come across in like as an application as something that, you know, you're really, you know, passionate and proud of. And yeah, there's no really one size fits all. I have classmates who are well, like, you know, into their 30s and have worked different careers before. So it's really on a timeline that makes the most sense for you. Applying when you feel like you really, you know, this is what you want to do and that you have the experience to get there. But you know, there's no right way to do it.
Thank you for that, for being transparent about all these stigmas students usually don't want to talk about. If you guys can go back to a time during undergrad, is there anything you would have done differently to prepare for medical school? And what advice would you give to your younger self for all these other undergraduate students?
Yeah, I think kind of going back to what I just said, I think something I would have done differently is I think I was so focused on my pre-med experience and building the strongest possible med school application. There are different things that I kind of like missed out on. Like, I feel like I would have liked to maybe participate in more like school groups associated with like dance or sports or things that fulfilled my hobbies and filled me up, as opposed to kind of just like building an application and building something like solely focused on medicine. I wish that I had expanded my horizons a little bit more in regards to other things as well. So yes, there's so many things that you have to do to get into medical school, but I feel like you're going to have a lot more fun on the journey, be a lot more fulfilled if you keep your mind open to all the rest that like a college education has to offer, other than just like forcing yourself down one single path.
My answer is super similar to Camryn's. I would just add, like, I think even when I was interviewing for med schools, I was asked more about my hobbies than like my volunteering or extracurriculars that were related to medicine. So I think, those make you who you are, and those are a really important part of your life too. So definitely make time for things that you enjoy.
Yeah, honestly, very similar. I was gonna say like I was pretty involved in like figure skating growing up and music, and I feel like honestly during college, like I didn't really do any of those things. Um, and so I feel like I definitely regret, not participating in activities that would let me kind of explore more of like the, I guess, arts side of things. And then also just in terms of like advice for your younger self too, is just like don't ever feel like you're behind in life because I think I don't know. I read somewhere it's like the only way you're going to be behind in life is if someone else is living the exact same life as you are, which no one is. And so in that respect, like you're never ever going to be behind. And I feel like a lot of times in undergrad, like you can feel that way. And as we've kind of mentioned too, like people have so many different life paths that they go on, and yours is obviously very, very unique. And so I feel like just taking that and I don't know, just kind of being grateful for that and living the life that you want to live is really important, and not necessarily just following like the cookie cutter model that we, so often heard just from, the pre-med experience with. So I think that would kind of be my 2 cents on that question.
Thank you. And when you guys were applying to medical school, were there any like out of the normal obstacles faced that people normally wouldn't expect to face when applying to medical school? So some example, I mean, I know you guys were applying during COVID, I'm pretty sure that's a pretty unique scenario. How did you guys like overcome that, or imposter syndrome and MCAT scores, and kind of going back to the whole like comparing yourself to other medical students and seeing that it wasn't as important in the end as it was?
I think for us, like applying during the COVID cycle, I think was difficult just because you didn't have exposure to a lot of, like you couldn't go into the hospital as much, a lot of volunteering things stopped, shadowing kind of was at a halt. And I think what really helped me personally was just like being able to communicate that you still somehow made the best of a pretty tough situation. And I think that can be applied to a lot of things. Like if you didn't do well in a class or didn't do well on the MCAT or anything like that, like if you kind of just show that you took that struggle and you were able to make something positive out of it and learn something from it and apply that to the future, I think that can speak volumes as well. And so for me, it's like, because I wasn't able to do X, Y, and Z due to COVID, like I filled my time by doing other things, like, certain examples. So I feel like that's kind of important. And then obviously just comparing yourself to others. I had a lot of friends who were applying to med school, and I feel like for us, it was more so like, it was just kind of like an unspoken thing that we wouldn't be like comparing or like sharing like all of our, interview invites or like, MCAT scores or anything like that. It was more so like we wanted to like support each other in whatever ways we could. So like if someone was struggling with like, oh, I feel like I'm not doing as well, blah, blah, like more so like act as a friend rather than kind of sharing all that information. Sometimes ignorance is bliss, and it's just like better to not share some of that information. But again, it's different from, friend group to friend group. But at least for me, I feel like that was kind of how like how we kind of approach things.
Yeah, biggest advice, especially during like applications, like stay off Reddit, stay off Student Doctor Network. Like that's only gonna, it's not worth it to see all that kind of stuff. Also, people can lie on that. So you don't even know if what you're reading from people is even true. But yeah, comparison is inevitable and really hard to deal with. And I think the thing is that everyone's journey is different. And hearing, all you really need is one interview and one acceptance to get into med school or whatever grad school or PA school or whatever you want to do. So, it really doesn't matter how other people are doing. All that matters is that you have confidence in your journey and you're doing things that fill you up and feel like are going to get you there on your way. Also, Mayo, all of us, we go to, it's a pass-fail school or pre-clinicals anyway, which makes medical school really nice that we all get to collaborate and work together. And once we're there, it's not competitive at all, which I think is something that I really value about Mayo. So yeah, I know it's hard not to compare yourself, but I think the thing, and something that's really hard to learn when you're an undergrad, but something that, you realize more in medical school is that it's only your journey that matters. And, it's not worth it to compare yourself to other people.
Thank you. That is all very true and unspoken about, especially the Reddit thing and online sources. So I appreciate that answer. This one was a very unique question, so I did want to touch on it. Do you know anyone who has joined the military to become a military physician?
We definitely have classmates who have. I don't know a lot about the experience. I don't know how much I can speak to about it, but um, I think I don't know if you're talking about like the specific. I think there's like a military scholarship. Um, I think one of an upperclassman, or I think generally like how that works. Like if you do get that scholarship for med school, I think the thing at the end is that you have to apply to like certain military bases and only do residency at those places. And then after that, I think you're free to go to other institutions, obviously. But I think that's kind of been, I don't know if it's necessarily a struggle, but I think that's something that you have to think about when if you do decide to apply for that scholarship. In terms of like people who come from the military, like we had someone in our class who was in the military as kind of like the first aid responder, and then he came back to med school to complete med school. And I think I don't know, Sumedha, you can probably, I don't know if you want to talk more about it, but like I think he has a lot of great firsthand experience that really set him up for success for med school. And he's always the one we kind of go to if we have questions. And he just is like super experienced and like knows a lot about like what medicine really is, because he's actually been like hands-on participating in that for so long. But yeah, so I don't know how much to yeah, I don't know what other questions, like if you have specific questions about that process. So I'm not super familiar with it. I just know that like those are some of the things that I've heard.
Thank you. And since this is the research symposium, I did want to ask, did any of you complete research in your undergrad? Did you guys follow through with it after you graduate during your gap years? And any advice with that?
I did work on research as an undergrad, probably for about 2.5 years. I worked in a like neuroscience lab, which was a lot of fun. I got to like do data collection, get to work with MRIs, get to work with people. And it was like a gerontology lab. So it was like a very specific subset within neuroscience, which is really cool. So yeah, that was a really great experience. And I kind of did that throughout my undergraduate degree. And then that transitioned to my gap year job, which was also in research in a very similar field, but a little bit more medical than just neuroscience. It was more like neurology, so kind of more clinical, but very similar experience. And I'm still working on like analyzing that data now, even after a couple of years. So that's pretty fun. And then now in medical school, I work on anesthesiology related research. So research is really great, but what I'll say about it is don't feel too stressed about like logging a certain number of hours. It's really more about learning about research, because it's a very particular process in some ways. So I'd say, like take the time to get to know like your PIs, get to know the grad students, get to know what they're interested in and how they became interested in it. Yeah, I think the people are really cool in the research world. So definitely take advantage of that.
I also did some research during undergrad, but again, I think it was hard to like really get any decent results just because you're so busy with other things. And so I think during undergrad, a lot of it was just learning the processes and kind of learning the procedures and the different experiments. And then during my gap year, since I was working at that same lab, I was able to apply all the things that I had accumulated during undergrad and actually kind of complete a project. And then also I know there's like I feel like you hear a lot about like, oh, you need to have like X publications for med school, and that is absolutely not true. Like you do not need a single publication to get accepted to med school, I honestly don't even like, if research is not your thing, like I don't even think you really need to like participate in research if you can find another meaningful way to kind of fill your time. So definitely like don't force yourself, I guess, to do research if you hate it, or to like stay in a lab if you hate it. Like at the end of the day, it's like you really do want to do things that you enjoy, because otherwise you're going to get burnt out so fast. And so yeah, I know there's a lot of pressure to like feel like you had a ton of research experience and there's such a focus on that, but really I don't think that's true at the end of the day. So yeah, hopefully that takes a little pressure off too.
Yeah, I also did a bit of research in undergrad. I did some like bench research in a traumatic brain injury lab throughout college. I also did some more like dissemination and implementation research in regards to telemedicine. I was lucky, I had really fabulous research mentors. In all the projects that I got to work on, was able to, write my senior thesis, published a couple papers, and my mentors were really hands-on, and I was lucky enough to be able to learn so much about the research projects, data analysis, scientific writing, through them. Honestly, I kind of joke that I learned more about biology through my research experience through my biology major. But like Cece and Sumedha said, it's more important to find sorry, to find projects and to find mentors that you really enjoy. It's not worth doing things just to do them. Your time as a pre-med and as a medical student is really valuable. And so you should only be investing it in things that you feel are fulfilling to your experience and things that you really actually enjoy doing. I know I had some friends in college who, they weren't really given as much opportunities to write and work on projects in their labs. So they ended up just leaving them. So yeah, I think if you're able to find a mentor in a project where you feel like you're really supported and you're given a lot of opportunities to like expand your knowledge and, even be creative and like think of projects and write and stuff, it's a really great opportunity and it's a really great way to learn. But if research isn't your thing, there are other ways to, build your application and get into med school for sure.
Do you guys have any advice of pursuing research in your gap years and starting research in your gap years? Since you're no longer a student, you don't have the resources of emailing a professor and saying, "Hi, I'm your student. Can I join your lab?"
Honestly, I feel like I've joined a lot of labs, like, or not, I don't know why I said a lot. I joined like my first couple labs that I joined was literally just by cold emailing the professors, because I found that their work was interesting. And I feel like if you wanted to stay at your current institution, I would definitely try to set that up while you're still an undergrad, like maybe senior year. If you want to stay like at the same campus, then reach out to them during your senior year, because that's when you still have like the opportunity to maybe meet them in person before you start your lab experience. But I definitely say like don't underestimate shooting a cold email to someone. And especially kind of if you can demonstrate that you're passionate in what they're doing, like I think most people would be inclined to respond. So that's how I found my like gap year research, like the lab I was in during gap year, like that's how I originally got started with them, was just by sending her an email. I guess other ways to get involved in research too during your gap year, I think if you are part of like any interest groups or like clubs during undergrad, like I think a lot of them, at least at my school, kind of would just give plugs for programs like research programs that you could apply to, or you could talk to upperclassmen about labs that they were in that they had a good experience in. So I think those are some of the things that I noticed was common kind of between my friends and I, in terms of trying to find somewhere. I guess also if you want to do research during your gap year, there are like more national programs, I think, like with the NIH or something. So you could look into that and apply as well. Yeah, but I think for me it was a lot of just like emailing someone, and that kind of worked out for me.
Yeah, I'll echo Cece. I was lucky I got connected through like my PI in undergrad for my gap year research job. Like I knew I wanted to go out of state and like go to a different institution. So I kind of sat down and talked to my like current PI and I was like, hey, do you know anyone that might want some help? So that fell into place kind of naturally, but like Cece said, there's really no harm in cold emailing. Like professors are expecting those emails. The worst that can happen is they won't reply, and that's okay. But the best that can happen is, they'll either refer you to someone else or take you on. So there's really no harm in doing that. Yeah, so I think just reaching out, especially if there's like an institution or a project that you're particularly interested in, I think just go for it.
Thank you. And there are a lot of questions about the interview process. How did you guys prepare for the interview? Was there any advice that you wish you had before the interviews? Any crazy stories of interviews?
I think the best way to prepare for an interview, I guess, is just to practice. I know my university had they had interview practice sessions where you could, one-on-one with like one of the career advising team, I think it was, which was really helpful. Even if your school doesn't have that, just practice talking with like a friend or a family member, basic questions like, why would I want to go into this field or things like that. But I think at the end of the day, I know like Sumedha brought this up earlier, is that most of the interviews that I had, I ended up kind of just talking about like my hobbies and what I like to do and, more like who I was as a person as opposed to my, accomplishments and resumes and things like that. But like anything, it's kind of a skill that you can build upon, even if you're just like recording yourself, like talking to your camera, is the best way to do it. But, you're never going to feel fully prepared. And it's just one of those things that, I trust you all, going to put your best foot forward and, really show who you are.
I totally agree. Sorry, Cece. I think, there's some questions you can expect to get that are just, the standard questions like, why do you want to go into medicine? And what qualifications do you have and whatnot? But I think for the most part, my interviews at various schools were all very conversational. They were really just tailored at getting to know me as a person, I think. Because you at this point you've already submitted your application. They've read through everything that makes you awesome on paper. So they want to know what makes you awesome not on paper, So I think just talk about what you're passionate about, and oftentimes you'll find that your interviewers will share commonalities with you, and that's a really cool thing to bond over. So
Yeah, and then just one small thing too to add, I kind of echo what Camryn and Sumedha already said. But for me, I think what I found helpful too is for some schools I did kind of get more like behavioral questions, like tell me about a time that you worked with someone who you didn't get along with, or tell me a time you struggled with, or tell me about a time that you advocated for someone else. And for those questions, I kind of just went onto Google and was like typed in, I think like 20 most common like interview questions or behavioral interview questions. And I just made sure I had like a little excerpt or thing that I could talk about for each one of those. And honestly, that was like enough for basically all my interviews. Just because most of them are pretty similar and it's just like the hard hitters. But I would say like in general, if you have like for me, I TA'd in undergrad and a lot of my experiences came from that. And so if you could just have like a couple experiences that you can kind of like pull from for experiences or for a little anecdotes that you can give, I think that's pretty helpful. Because in the moment it's hard to think of those, but if you kind of prepare that in advance, I think that's helpful. So maybe like besides like the questions just about who you are and what you're passionate about, maybe a couple like behavioral questions I think would be helpful, just because some schools are like that. And then I don't know if you guys might have to do some like MMI interviews, and those are like a very different format. And so for those, like I would practice, like I would look up common MMI questions and then just practice doing those by myself, because I forget the exact format, but I think it's like you get 2 minutes to prepare an answer, and then you have to talk about it for 6 minutes or something like that. And so I think that's definitely a skill that you can also have and build. And so I think that with that just comes a lot of practice.
Thank you. The next question, this one was another unique one. How might your perspective on healthcare and patient care evolve since starting medical school?
It's a very all-encompassing question. I feel like I think I've definitely become way more inspired since coming to medical school because during undergrad, I don't think I got a lot of like hands-on opportunities to see what doctors actually can do for patients. And since coming to med school, like through shadowing, even just like a few hours here and there, I think I've really been able to see the difference that sorry, I know a lot of this is like tailored for med school because we're all med students, but like for any kind of pre-health for any health profession, you can really once you actually begin like the formal training for it after college, I think you can get a lot more insight into what you're able to do for people to help improve people's lives. And I think that goes a long way in terms of getting you through, the grueling years of schooling. I guess what I've noticed about specifically for medicine, I think is, and I didn't appreciate before, was how longitudinal some of these treatments can take. Like a lot of it is working with patients, for years and years to find and modify and change their treatment plan, their medications, their dosages to figure out what works best for them. And as they go through different phases of their illness or disease, like how you can tailor that and how you can tailor your treatment to them. And so a lot of it is like a really longitudinal relationship, which is really cool. And you get to know these people for many years. I guess some other things, I think it's just like seeing, the doctor's commitment to their patient has been really eye-opening to me. They work really long hours and they work really hard, but at the end of the day, like you can tell that they really do love what they do. And so I think that has also been, really important, just helping me get through like all these classes that I have to take. But yeah, I think those are just some general thoughts I have on the question. I know I was kind of rambling, but
Yeah, this is probably going to seem like really obvious and cliche, but something that I've realized in starting medical school is like how intelligent and smart like doctors and other members of the healthcare team actually are. Now that I'm like learning medicine, I'm like, wow, you guys actually know so much. And you have to put together so many different like pieces of knowledge about like, biology or physiology and a patient's lifestyle and like combine it into, a diagnosis and a treatment plan, which for me as a medical student is really inspiring.
Thank you. And a couple questions came in about specializing. I know you guys, we don't specialize until pretty much the end, but what time should you have a strong idea of when you would like to specialize? And is that super talked about between all the medical school students as much as people think?
I think it's probably one of the most frequent questions you'll get as a medical student, but the consensus is, don't feel too stressed about it. We have classmates who like went through medical school knowing they were like, okay, I want to be an ENT, and then they did their surgery rotation, like hated it, completely pivoted fourth year, so it's kind of like choosing a major, right? Like you have an idea kind of going into college, but it's totally possible to change paths every now and then. So, if you are really passionate about something from the beginning, definitely pursue it, but it's also totally okay to switch around. I'm still relatively pretty undecided as well, even like late into my second year, and I'm sure it'll stay that way until I'm pressing submit on my residency application. So don't feel too stressed.
Yeah, I think one piece of advice I got all the time from different doctors that I've like worked with and shadowed over the years was to go into medical school with an open mind. You might think you want to do something and then, you'll do that rotation and realize you hate it. Or there might be something that you go in and you're like, oh, I would never want to do that. That doesn't really interest me. But then you'll meet like a mentor in that field and be like, wait, like actually this is really cool. And especially as you learn like about different specialties in more detail, it kind of opens your eyes to things. So yeah, that would be my biggest piece of advice. Like, don't feel like you have to go into medical school with an idea. You can go in completely undecided. There are going to be plenty of opportunities for you to explore different specialties, work with different mentors. And honestly, I feel like you're kind of doing a disservice to yourself and to your education if you kind of prioritize some things over other times. This is like 4 years for you to get exposed to all different kinds of things. And yeah, it's really like, you don't need to decide right away at all, for sure.
I think part of it's also like there's a lot of pressure, as Sumedha said, like during the holidays, like everyone is gonna, especially your first year, gonna be like, oh, what specialty like do you want to do? And it always feels like you have to have an answer. So sometimes I like have an answer prepared, just like answer, but deep down, like I know I'm not super sure at all what I want to do. A lot of it's like I think in the beginning, like the most you can really narrow it down to is like whether you want to do a surgical specialty or a medicine specialty, because a lot of my classmates now are like, there's no way I want to do surgery. And I think it's a little easier to figure that portion out, but a lot harder to figure out, what specific specialty you want to do. But you also have to remember, like, this is going to be like your career. And so kind of what Camryn was saying, like you want to put in the work in the front end to really explore and to give yourself the time to figure out what you want to do, than to apply to a specialty and then realize, 2 years into residency that you absolutely hate the specialty. Obviously at that point, like you can still change and there are things that you can do, but it just makes it, I think it would be a lot better for you if you kind of kept your options open and took the time to, give yourself the flexibility to figure out what you're passionate about early on during med school, rather than try to like retrospectively do that after you're already in a residency program. But definitely, like, I know a lot of people, even like fourth years, like a couple weeks before they're applying, they're like, okay, I think I've figured out this is what I want to do. And yeah, so not a lot of pressure, but just kind of use the rotations that you have and learning opportunities that you're provided as like a way to really get involved and kind of see what it's like, and like to actually be on the floor and doing that specific specialty.
Thank you. And how did you all build a balanced list of what schools to apply to? And how many did you apply to? And what are some things that you looked for?
I think the MSAR is a really good resource. I forgot what it stands for off the top of my head, but basically it's like that database that has a ton of information about different schools and their average GPAs and MCATs and things like that. So I think look at that for sure. Consider that location is typically a strong factor. So I'm from California, so I applied to kind of all the UC schools and all the state schools in California. And then certain out-of-state schools are pretty particular about only accepting, in-state students. I don't have an example off the top of my head, but, just keep in mind that those are factors you want to consider. Location was a big thing for me. So I knew that I wanted to stay somewhere relatively sunny, which is why I'm here in Arizona. And also just like the school culture. So this is my plug for Mayo, I guess. I think we have a really great culture here. It's a pretty small class size, so we're all very supportive of each other. So I think about things like that and really keep an eye when you're interviewing on whether you feel that you would be a good fit there.
Just to give some numbers to it, I applied to 30 schools, which I think was probably an overshot for me honestly. At some point, like there's probably a couple schools in there that I really like, even if I'd gone, and I don't think I would have gone. And so I think that's another part of like cultivating your school list is like, be honest with yourself. Like, do I really want to write all these secondaries for a school and pay the admissions fee if I know I don't want to go there? Like, obviously there's, I think, that pressure of like, oh, I need to apply to a lot. Like, what if I don't get in? And although that is the case, like you also, if you know you're not going to be happy at a school, like there's no point in kind of putting yourself through that. But yeah, there's no, I know some people will say they applied to like 60 schools or something like that. And again, all the Reddit threads and all that, like there's just no reason to overdo it. Like definitely have a good stratified list of like reach schools, kind of like the same thing you did for undergrad, probably like reach schools that, you would be like just maybe a little bit above your technical like grades and stuff like that. But then also have, schools that are kind of in your general range of what you think you could be accepted to. And then also like, I guess they call it safety schools. I don't know if those really exist for med school, but just, things like that. And then just make sure you have like a diverse list of schools. I know some people only apply to like the top 20 schools and, they don't get an acceptance. Then obviously that's kind of tough, but also like just at that point, like you should have been a little bit more thoughtful about like what schools you're applying to, I guess. So yeah, stratified list with like a good combination of, different calibers and stuff.
Yeah, same. I think I also applied to 29. Well, I applied to more, but then I wrote like 28, 29 secondaries, and I was like, yeah, I'm done. But yeah, like Cece and Sumedha are both saying, stratified list is really important. I think something that I realized is that like applying to medical school is really such a crapshoot. Like you don't really know where exactly, like there are some schools with like much higher GPA and MCATs that I got interviewed at than schools with lower ranges. And, so it does seem smart to hedge your bets, but at the end of the day, like you can do everything right in the world and it's a very difficult process. And I have so much respect for all of you that decide to, put yourself out there and go through it, because it's emotionally exhausting and so much work. And so whoever decides to, go through with that, like, I'm really proud of you. And, just tell yourself that you're amazing, and whatever things work out the way that they work out.
Thank you. And this will be our last question. So I want it to be kind of a fun one. How do you envision the transition from preclinical to clinical rotations, and what are your expectations for that phase of your education? So are there any rotations that you are looking forward to the most?
I'm honestly really looking forward to, I can't say there's one rotation that I'm most looking forward to. I think right now I'm really interested in like a surgical specialty, so I am kind of excited for that. But like I said earlier, like I'm really keeping my mind open right now. So I'm just excited to get to explore all the different things, see what I like, see what lifestyles, see what different, clinical applications that I like doing best. I think I'm at that point in my career, medical education career, where I'm not too burnt out yet and everything is still super exciting. I don't know if Sumedha and Cece would agree with me, but yeah, med school is fun. It's really hard, but it's fun. And I'm really excited for the rest of my education and journey and all that.
I think, yeah, I'm excited to start rotations. I mean, I've heard that it's a lot of work because you're at the hospital all day. And it's very different from school. Like you're not just studying, like you will have responsibilities and will be seeing patients. So part of it's really anxiety inducing for me, and like I'm nervous about it. But I think at the same time, like Camryn was saying, like that's when you really get to apply, everything that you've learned in your past, like 14 years of schooling, like into something that actually matters. And I think that will be like very exciting and a lot to look forward to. And I think also like just hearing patient stories, I think even in the few that I have heard just through shadowing and stuff, like it really does leave a mark on you. And like those will be things that you will be thinking about, like, a couple weeks down the line, like you'll still be thinking about that patient. And I don't know, I just feel like it's honestly such an honor to to like any healthcare profession is honestly such an honor, because we get to like really be a part of patients' lives when they're so vulnerable, and be a support system for them in some ways. And I think that during rotations is when I'll really be able to kind of experience that firsthand and be able to get a better sense of what that really means and what that looks like.
Alrighty. And I lied. I'm gonna ask you guys one more question. What made you choose medicine instead of being a PA or a nurse practitioner or anything else in the healthcare?
This is a good question to think about for interviews as well, because you'll probably get it. But in my case, I actually started out probably wanting to become like a physical therapist. I played sports a lot, and so that was something that was always really interesting to me. But I think I kind of tried to shadow different health professionals and see the dynamic between those professionals. And everyone in the healthcare community is super vital. Like it's definitely a team sport. You're not going to see doctors like doing everything by themselves. If any of you have been in the hospital or like been to a doctor, you know that like your nurses and your PAs are doing a lot of work as well. So everyone's super important to the healthcare team. I think I decided to go down the route of becoming a doctor in particular, or a physician, because I liked the idea of kind of being the head of the team. So kind of directing diagnoses and treatment and things like that, which is not to say that, PAs and NPs can't do that too, but I think I would just, in shadowing, liked the dynamic of the position a little bit better.
Yeah, I think another reason that I kind of chose the MD route over something like PA or MD is really kind of like the depth of knowledge, especially in regards to things like biochemistry, pathology, that kind of thing that you get in like a 4-year MD program as opposed to like a 2-year PA program. I kind of liked the idea of having, all of the knowledge that comes with that kind of education as well.
I really don't have much to add on top of what Sumedha and Camryn said. I think those are kind of my main reason too, is like, especially like knowing like the pathophysiology of why diseases happen, and like, although med school is really long, like you really do get to see like every little kind of detail on stuff like that. So, and also if you're interested in just like the basic sciences of things, I think also med school is pretty conducive for that.
Alrighty, thank you so much for all your answers. They were great. And thank you all the attendees for your amazing questions. I wish all of you the best of luck when applying, and I wish you guys the best of luck for the rest of your medical school career.
Yeah. Thank you so much for presenting at our medical student panel of our research symposium. It's been a pleasure, Camryn, Sumedha, and Cece. But we're going to go ahead and transition to our awards. So if you're free to stick around and see who won the research presentations awards, but if not, of course, no worries. I know you were all super busy with studying and your medical school rotations. So, but thank you again. And I'm going to go ahead and share my screen with our presentation, and we'll get started on the award winners.